Welcome again to TYT Interviews. I'm Dave Koller. With me here today is Minda Wilson, a corporate attorney specializing in healthcare. Now, healthcare is a subject that almost nobody else at TYT cares about. That is why I am doing this interview today. Almost before every interview I do, I always have to explain why I'm the one doing the interview and not our usual stable of hosts. So Minda, welcome. Thank you for coming on to TYT.
Thank you so much for having me.
Yeah, so let's talk about you really briefly, because there's plenty to talk about with the subject at hand. But so you're a corporate attorney specializing in healthcare. What do you do on a daily basis related to healthcare?
So what I do is I work with a lot of companies in the healthcare field, helping them cope with the problems related to Obamacare and then helping them make money in the current environment.
Okay. Now, did you know that healthcare was very complicated?
I did, but it seems very simple to me. It seems like it's very, very easy to understand.
Well, that sounds like you're advocating for simple solutions, so we might have to get into that to see if that really holds up. Of course, you know I was alluding to Donald Trump's comment.
I know, but I was trying to
ignore that
and
justly so.
And move on.
Okay. So let's start with this. So you wrote a book, Urgent Care. I think it was published in 2015?
In October of last year.
Is it in danger of being irrelevant if President Trump and the Republican Congress repeal Obamacare? Then what applicability will your book have if it gets repealed?
Well, to me, the answer is everything I talk about in it is relevant whether or not the Affordable Care Act is repealed, because it's solutions to making healthcare affordable. So, and now, even if it's repealed, all the discussions about replacing healthcare are about providing more insurance for people, which will continue to make healthcare unaffordable.
Right, okay. Well, we're going to get into all that. We're going to take our time. We have, 30 minutes here. So I want to get into a couple of general questions. You're an expert. We're going to get into Obamacare. We're going to get into prospects for repeal, but I want to talk about Medicare for a second. It's a confusing subject to a lot of, well, no, let's talk about you for a minute. Are you a very political person when it comes to healthcare? Are you on a side, or are you more of a technocrat?
I'm more a let's fix the problem, and I don't care which side is. I'd like both sides to be involved in fixing the problem. I don't really want to. It seems like this is the stupid people problem, and nobody's being smart about providing solutions.
Do you have like a horse in the race that you're passionately supporting all the time, some strong ideology in this matter, or like an advocate of single payer, that's all they'll ever talk about?
Well, no. I have a solution, and I'm an advocate for the solution.
But your solution is not a one-liner.
It's actually quite simple. Okay. It's a comprehensive program that would make it so that every American could have health care and that it would be affordable. And the basis of that solution is a health savings account coupled with catastrophic coverage, and that would make a significant difference in the affordability of care, and it would give people discretion so that they could make decisions about their own medical care. The other thing it would do is it would serve to get the insurance business away from controlling medicine, which is one of the big problems we have now. Insurance companies, because they control the money, dictate care. And one of the things that's really shocking to me in the research that I've done is the CDC did a study, and what they found out was only about 10% of the money you pay for your policy actually goes to pay for your medical care. The rest of it goes to the insurance company to help run its business.
Well, I got to question that, or what that even means. The whole point of insurance is that many people will pay insurance and they're healthy and they will never use any the health providers. So 0% of their money is going to their health. Yeah, but that's fine. That's what we need. There's other people who are more sick, and they're the ones who need the insurance. But we're all in it together.
But I'm saying that the CDC studied all insurance outflows across the board for the sick people and the well people. And what they found out is that of your $20,000 a year premium for your family of 4, only $2,000 of that is actually paid for care by the time you pay your deductible, which means that the insurance company is using $18,000 to run their business, which to me, if you're looking at affordability, seems like it's a big problem.
I don't get what that means. If you're the family of 4 and your health insurance costs $20,000 a year and a couple of your kids are sick, a couple of broken arms, a couple of weird diseases, the medical bills could easily come to $18,000 and the health insurance company is going to pay most of that. So it's not $2,000.
Not exactly. On average, what they found is for people 18 to 64, which is what the CDC studied, they found that people do not use their insurance that much. That on average, based on all the census data that they gathered, that people actually only go to the doctors on average 3 times a year.
Sure.
That people only go to the hospital maybe 1 time a year, less than 1 time a year. That people have some kind of emergency or urgent care problem less than 1 time a year. And we're talking about adults here.
Yeah.
So when you add up the cost of what those treatments cost, and then you subtract your deductible, it ends up being somewhere around $600, $1,000 after you've paid your deductible for an individual adult.
Okay, but there are some, and I don't know what percentage, maybe you know, who go to the hospital and the doctor a lot more than that.
Yes, but that's on average. So the people who go to the hospital a lot are offset by the people who never go.
Right.
So that's what this is the CDC who discovered
Well, yeah, who am I
this.
to question the CDC?
You know,
but
I'm just saying that it's not political. It's not the Republicans saying that. It's not the Democrats saying that. It's the CDC who did an independent study. And what that means for us is that we are paying a lot of money for insurance, and very little of it is actually going to the people who are administering the care. And that is the real problem with the healthcare system.
Sure. So in your comprehensive vision for a solution, would there be health insurance companies, or would everyone just have an HSA?
There would be a health insurance for catastrophic coverage, but also there would be some regulation on what amount of that money you pay for that catastrophic coverage goes to the insurance company and then goes to the providers who actually care for you. Now, in the Affordable Care Act, they did try to do that. They had something called the minimum loss ratio, which was to say, you know, only 20% of overhead was supposed to be, but the minimum loss ratio is not an effective management tool for looking at money in minus money out, because a lot of things can be counted as the cost of doing business. So the cost of doing business is all the people who review your bill that you put in, that counts as a claim. So if you have 5 people that review your bill, that's before the minimum loss ratio kicks in. If a senior level executive is a physician, then they're practicing medicine, and that doesn't count for the minimum loss ratio. So you have a lot of ways insurance companies can get around it, and you know, and then if you have experimental programs or programs that are supposed to improve the efficiency of the insurance company, those programs don't count under the minimum loss ratio. So one insurance company decided that when they were going to start selling Obamacare products, they would buy a fleet of ice cream trucks, good humor trucks, and they would man these trucks with insurance salesmen, and those insurance salesmen would play good humor music and drive through neighborhoods in the attempt to sell policies. And that's
marketing.
Yeah, it's marketing, but that's not the cost. That's not your doctor bill.
Right.
That's not your hospital bill.
Well, yes, we all know that we don't want too much of our premiums going to marketing. We want it to go to health care. But there's a certain inescapable logic for the need for health insurance companies. And if you need, and let's challenge that, or have you challenged it. If everyone's just floating out there with an HSA and being responsible for their own routine medical insurance, but then you don't have any leverage. What an insurance company does is it groups people together and it says to the doctors and to the hospitals, hey, I got this whole group of potential customers for you. Now let's talk about good rates for them. And an insurance company advocates on behalf of in theory, the people, the health care recipients, and gets you lower rates at the hospital and for the doctors.
Well, I agree with you, and that's why I'm advocating that we have a catastrophic policy. Mm-hmm. But also, you have to remember that there was a time in this country, and it wasn't so long ago, when people weren't insured for things other than catastrophic illnesses.
Right.
And doctors dictated treatment prior to the need for catastrophic care. And what happened was people were overall healthier and they get more personalized treatment. And this happened because the doctors were paid more. I mean, now under a typical plan, a doctor gets reimbursed somewhere between $40 and $100 for an office visit. And for a lot of doctors, that doesn't actually cover the cost of them having the nurse in the room. Mm-hmm. So you really have to look at what they're being paid relative to the cost to operate. And you also have to look at, in the olden days, when I was a kid, doctors were able to go out and volunteer one day a week, because they made enough money in their practices where they could give away their services to people who really needed it. And that was the typical program. And in small communities, doctors took all comers. If you could pay, if you couldn't pay, the doctor took everyone. So I don't agree that Insurance Act is required when you're looking at cases where people are generally healthy and have something like diabetes or a heart condition or something like that. If they have cancer, if they have a stroke, if they have something more serious than that, then you need something to hedge the risk of a devastating financial experience to your family.
I'm not totally sure I understand your proposal, but let's jump to it and talk more about your book is Urgent Care, 10 Cures for America's Ailing Health Care System. And in the final chapter, you present those 10 steps, right? Mm-hmm. And I don't quite know how they are even part of a solution. Let's just go through them one by one. Step one, if corporations are people, why can't people get the same tax treatment for their health care as corporations? What do you mean by that, and how is that part of a solution?
Well, for me, it's interesting that a self-employed individual who doesn't have a corporation, or even someone who does not, who fills out a 1040 for their business, mm-hmm. and doesn't have a separate return for their business, they cannot, if they buy health care for themselves, or if they buy health care it's not deductible.
Right.
So I find that interesting. I mean, the Supreme Court said corporations were people, so they had the right to give money in elections, and so I don't understand, if people are like corporations, why people can't deduct things that corporations can deduct. It seems unfair.
Okay, I get what you're saying, and I sympathize with that logic, but then looking at this like an economist, then all you're saying is if personal premium payments for health insurance, or are you saying personal payments to doctors for health care are tax deductible, then that's just the government subsidizing your health care.
It is.
Which is fine.
It is, but if I'm a business, mm-hmm. and I get to write off the health care costs of my employees.
Yeah, why shouldn't an individual?
Why shouldn't an individual who has a business, who's responsible for buying their own health care, who's employing people, adding to the economy, why don't they get the same right? It just makes no sense to me.
Step two, if gifting programs are so successful, why do corporations purchase insurance in the first place? Where are you going with that? How is that a step toward the solution?
One of the alternatives to insurance are gifting programs. So one of the opportunities in the Affordable Care Act to obtain coverage outside of an insurance company is through what's called the gifting program. In that, it's after-tax dollars the corporation pays or individuals pay who join, and then they belong to this gifting program. And it turns out that if you look at the cost to be fully insured by a gifting program, it's $175 per adult per month. It's limited to a family of 4, so it's $600 a month. That's the maximum cost for a family of 4. And it covers, after a $500 deductible, all of your healthcare costs. Now, there are some rules about who can belong to gifting programs and who can't, but it's an after-tax benefit for corporations. They aren't allowed to deduct the contributions. The thing that's interesting about this is if you look at that, the difference between what they pay to a gifting program and what they pay for an insurance product is hugely significant. And also, in a gifting program, all the services that you look at for an insurance company, like negotiation with hospitals, negotiation with providers, all that's done. Mm-hmm. So it tells you that the overhead that the insurance companies are charging is out of line with how it can be done through these gifting programs. And it says we're paying way too much for insurance products, in my opinion.
Got it. This whole concept of comparing it to gifting programs is not something that I have heard discussed very widely in the mainstream media in all these past 6-7 years of debate over healthcare. And that's what struck me about some of your steps, including that one and including a few others. They seem like details. Allow urgent care centers to tend to perceive non-life-threatening health emergencies and enable patients to have immediate access to emergency room facilities for those that otherwise prove to be critical. All important, but that's a small part of...
It's half the healthcare deficit, just doing that. Uh-huh. So $78 billion a year is paid for people going to emergency rooms,
right.
Uninsured people going to emergency rooms. Allowing them to go to the cost for an emergency room visit for a kid with an ear infection is about $300 on average in this country. At an urgent care, it's about $40.
But who said the urgent care center can't take the kid with the ear
infection? They
can't.
If they don't have insurance now, urgent care centers won't take them.
Okay, but that's because the urgent care center doesn't want to take people without insurance.
No, it's because we have a law that says an urgent care center won't be paid if they take an uninsured person, but an emergency room will be paid if they take an uninsured person.
But now we're getting into, and we can't go through all 10 of these or people are going to lose their minds, but all this talk about costs and how an emergency room costs $300 if your kid goes in with an ear infection, the cost is made up. It doesn't really cost $300. They just make the cost out of nothing. We've had discussions here on TYT about people who go to the doctor for a physical, and they come back with a $3,000 bill.
Of course they do.
And then they talk to the doctor and said, oh, we'll cut it down to $1,300. They just make up numbers.
But again, that goes back to the way the negotiations with insurance companies started. Mm-hmm. So you started with an outrageous number that was irrelevant to what the thing actually cost,
right,
so that you could negotiate a percentage settlement with an insurance company or some other kind of organization that was going to pay you so that you could get paid close to what it actually cost you. So over time, the rates kept getting higher and higher and higher, and the percentage of reimbursements kept getting lower and lower and lower, and then, eventually, the doctors get screwed. That's really what happens.
Right. Okay, so I'm left a little puzzled by what your overall solution is, and you've said it before, but it's okay to ask you to repeat it. So what is your comprehensive solution to America's healthcare system? Can you describe it again, please?
I think what we need is a health savings account coupled with a catastrophic policy.
Well, by the way, health savings accounts exist.
They do, but the limit on them is $2,500,
Okay.
and that's not tied appropriately to what people actually have to pay out of pocket. Like if you look in my area where I live, this year for somebody my age, married with 2 kids, that my health insurance policy, because I made more than $100,000 last year, was $20,000. That's the unsubsidized cost. So everyone in my neighborhood, no matter if they make more than $100,000, that's what they pay. And in addition to that, we have a $10,000 deductible. So that means that basically you're looking at $30,000 out of pocket
Right.
before insurance kicks in. And next year, based on what I've heard, they're talking about raising insurance premiums about 40%, not 40%.
Right.
So at a certain point, you make it, for the person that makes $100,000 a year, $150,000 a year, they just can't afford it anymore. You can't afford coverage.
So if I translate what you're saying into libertarian terms, you're saying that for non-urgent or non-catastrophic health situations, we shouldn't have insurance. We should just have health savings accounts. And everyone should just monitor their...
That's the way it used to be.
Used to be before World War II. How far back?
No. Until the 1980s, that's the way it was. Insurance companies were basically provided catastrophic coverage, and people paid out of pocket. And then some of the laws changed, and they started monkeying with the system, and people started getting more coverage for things that were not covered before.
Are there any countries that do a system similar to what you're envisioning or proposing?
No, not really.
We might have to get back to that when I've had time to think about it. But let's go back into the early chapters of the book and build up to the conclusion.
I think what I'd like to say is, people talk a lot about single-payer systems. Yeah. And I'd like to say that single payers are very good systems in a homogeneous society. They work very well. But what we're seeing now in Europe is when you have an influx of people that haven't had consistent medical care the way the population in Europe had in the past, it's now bankrupting the system. People are waiting longer, they're not being able to get care, and it's not really a successful plan. Even in Canada, people are coming to the United States because they have a lot of age-specific metrics that say if you're over 65 years old, you can't get a knee replacement, which may not be, for somebody who's 20, they think that's old and they don't need a knee, but for somebody who's 65...
They see another several decades of life in front of them.
Exactly. And so that's something that's a bit of a concern to me, is that when you talk about the single-payer problem, and then we also had an experiment in the United States where they tried a single-payer system in Vermont.
Right.
They adopted it, and it only lasted a year. Why? Because in order to pay for it the next year, they would have had to raise state income taxes from 14% to 24%. And people were not willing to give away 10% more of their income to pay for health care. So it hasn't really been a successful plan, and there may be a way to implement it successfully, but I don't know of one.
I look at health insurance for a society in a very economically theoretical way. We're all in it together, and especially in a country as big as the U.S., as big and diverse. There's going to be someone is going to experience every possible imaginable health situation.
I agree.
So we need to help each other. With
I
just
agree.
the HSA situation, I know you're talking about covering the catastrophic situations, but even below catastrophic, it can be pretty devastating to have to pay these costs year after year after year.
I agree, but here's the thing. You made a very good point, and your point was that insurance companies are supposed to be hedgers of risk. Okay, but they're no longer hedgers of risk. They're investment companies. They own real estate.
Right.
And the way they got that money to buy that is two ways. One, by having excessive margins on their products, and two, by managing the float that's associated with insurance products. And as long as you have them, their primary business is no longer insurance, hedging the insurance risk, and their costs being tied to that cost of hedging the risk, then they're not really doing what they're intended for. And we have to look to something to replace them that is appropriate, that creates an appropriate price structure to reflect the hedging of risk.
Okay, now that's a vision that I kind of like, so we are coming to some sort of understanding here. Let me change gears though, because I was fascinated by this imagined, or that's what I'm going to ask you about, family that you talk about in this book here on page 102. If you recall what I'm talking about, step in and figure it out. You're talking about you envision a family, a guy who grows up middle class in Iowa, mom's a homemaker, dad's a postal worker. And it was his dream that the kids would go to college. And so the kid did. He studied accounting, graduated, got a good job at a good accounting firm, got married, had 3 kids, was making a lot of money, $100,000 a year or so. Life is good, you buy a house. You know what, you remember this anecdote? And then, but all of a sudden, life is good, except you can't afford a goddamn thing. It's not enough money. Everything's too expensive.
That's exactly
including
right.
the health insurance. So first of all, is this family, did you truly imagine this or make it up, or are you modeling this after someone you really know?
No, it's a real family, and the data was verified with census data.
But because it is a very good representative anecdote of, these are not people who are at the bottom of society. They're at a very high level, but they just can't make it.
And that's why if you look at savings, what's happening with savings? You know, a lot of people in this country are facing retirement and they don't have the money to retire.
Right.
So what's going to happen to them, right? What is going to happen to them?
Well, in this family, you go on. It's not just about health insurance. They have kids going to college. You add up their mortgage payments, their car payments, insurance, food, clothing. There's nothing left. There's nothing left. And you worked hard and you did everything right. You got a good job and it's still not enough. And that's frustrating.
Well, that's part of the problem.
Yeah.
I mean, that's what solving healthcare would go a long way to fixing that, you know.
Right, but to repeat my question though, the numbers are verified, but is this a real family? Like this was John Smith?
It is a real family, but it's also, in my travels across the country, I've met many real families that this is like. And they may not be accountants, but they may be doctors, or they may be lawyers, or you have a doctor that's graduated from school and now doesn't get to have his own practice because he has too much debt and he doesn't have time to build it, and he works for a large health system, and he's making a lot of money. He's making, let's say, $200,000 a year, which is more than an average family practice doctor makes in this country.
Right.
And by the time he pays his $800,000 medical tuition back that he borrowed, there's not much left. I mean, it's not just this family. It's many families.
Okay. Well, I thought that was a good illustrative anecdote, and I like that page or that section of the book. Random subject, you talk about the TPP, which is now gone, and drug prices. Can you get into that a little bit more here? What was the TPP going to do, good or bad, with respect to drug prices in America?
I think the problem is part of the deal for the Affordable Care Act, which is really shocking to me, was that they agreed to not negotiate prices with drug companies in exchange for certain concessions, which they got, which is close, And what happened is that agreement not to negotiate allowed the drug companies to say, I'll set whatever price I want. And that's where we are now, because the government has said we will not negotiate. So all those quantity discounts we used to get and all those deals, they're gone, because we said I mean, think about it in your own life. If you had a business and somebody said to you, you can charge me whatever you want and I will not negotiate with you, what are you going to do?
Right. So I want to get a sense, 5, 6 years later, since it was passed, what's your take on the Affordable Care Act? Completely insufficient, good, bad?
I think one of the best parts of it, honestly, was the expansion of Medicaid. That actually helped a lot of people because it took working poor and it said, you will not have to pay for your health care anymore. And these are people who have, you know, who, if you worry about the family that makes $100,000, imagine if you're a family that makes $30,000. Right. And so in West Virginia, they did some studies, and what they found out was that it had 3 positive effects. The first effect was people worked more, so they earned more money. The second positive effect was that kids went to school more. Because they were, you know, it wasn't the cycle of mom getting sick or the kid getting sick, passing it to mom, passing it back to the kid.
And having to take care of each other.
Yeah, all that went away. And then the third thing that was most interesting to me was that emergency room costs went down because they had health care. So they didn't have to go to the emergency room to have their health care needs taken care of. So that was, in my opinion, that's a very successful program, and I think it's benefited a lot of people.
So why isn't that a reason to advocate for single payer for everyone, not just for the indigent?
Because the cost of that program is enormous.
Cost of which, what I just said?
Medicaid is enormous.
Yeah.
And if you were to offer it to everyone, it would be unaffordable. Our tax rates would have to be twice what they are now in order to pay for it.
Well, the cost is enormous, but the benefits are enormous too. You just outlined the benefits.
But again, you know, let's say you make if that poor family had to pay for everyone's health care, including yours and mine, their income wouldn't be $30,000 anymore, because we would have to tax them. Right,
but that rich family is paying a lot more taxes too for their health care and for the poor family's health care.
It wouldn't be as they found in Vermont, which is a relatively wealthy state, it wouldn't be enough. The impact on taxation would be so significant that people couldn't afford it.
I mean, I can see that, but what I envision in my ideal world, which is just numbers, you take all 350 million Americans, old, young, poor, rich, sick, not sick, there's a health care need for all of them and a cost. Take that cost, how many billions of dollars it is, divide it by 350 million, and that is what each person, man, woman, and child, should contribute every year to our one giant single-payer health insurance system. That's like a textbook model of how it should work, right? Why can't we do something like that?
Because what they found in Europe is that you have to have homogeneity of care. So you have to say to the person who doesn't want to vaccinate their children, if you don't want to vaccinate your children, that's fine.
You still have to pay for it.
But you're not eligible. You're out. If you want to have, if we only allow X drug and you want to take Y drug for your chemotherapy, you're done.
Right.
If you want to need, and you're out. You not only are you opting out for that, but you're opting out for everything. You're no longer eligible for care.
The thing is, if everyone is running around with an HSA, and most people are taking X drug, but a few want Y drug, well, there's not enough demand for Y drug. The drug companies aren't going to offer it because they're not going to make their money back. Or they're going to have to charge thousands of dollars for Y drug or some huge sum. So you might not get Y drug anyway if it's too expensive.
Well, we do have an orphan drug program, and that's been very successful. And the drug manufacturers still seem to be interested in making drugs with limited use. And then one of the most interesting thing that's going on in the pharmaceutical world is that all the drugs now are being checked out to see if they can be used for something else.
Right.
So one of the most interesting things I learned was ketamine. So it's an anesthesia. So they used to use it at the VA for giving vets surgery, anesthesia during surgery.
Okay.
And so what they found is that when the vets who had more than one operation came out of the second operation, they didn't have PTSD anymore. So they found that ketamine actually has been successful in the use of helping veterans that have
So it
PTSD.
has a psychiatric effect or psycho?
Yeah.
Oh,
so who knew, right?
Right.
So what's going on now, the most interesting thing to me is there is this movement to look for new uses for drugs that have already been approved.
Mm-hmm.
And it's happening everywhere. And it's really interesting. And it's been very, very, very successful. So I'm highly optimistic about a lot of this. It's very exciting.
Yeah. I mean, the developments in pharmaceuticals and healthcare in general are very exciting, but the key is to get people access to all of that in an affordable way so that it can be of use to the population.
Well, again, it used to be that drugs were monitored in regulation, but we gave that up. Mm-hmm. So, we have to go back. The pendulum, repealing the Affordable Care Act we'd go back. So the question now becomes, what does it mean if we go back? What would happen if we just repealed the Affordable Care Act?
Thank you. Let's make that our last subject today. So yes, what does it mean if we just repeal?
So what happens if we repeal the Affordable Care Act? In 2017, this year, it really means nothing for most people. And, I don't want to put my lawyer hat on, but basically what's happened is I've made a contract with the insurance company. The insurance company has agreed to honor my contract. That's the way it is.
Right.
So they can't
For a year, yeah.
For a year. And for the subsidized, for people who get subsidies, I've made a contract with the insurance company. The insurance company has made a contract with me, and they've made a contract with the government to pay the subsidies. Mm-hmm. So if the government doesn't pay the subsidy, that wasn't my deal with the insurance company. My deal was that they would have to look to the federal government to get the subsidies. So they can't say, oh no, we're not going to cover you because the federal government didn't pay.
Right.
So, and then with Medicaid expansion, the expansion of Medicaid, in order to facilitate that, I don't think people know that healthcare is actually managed and run in the individual states. So if a state agreed to provide Medicaid expansion for its citizens, then they passed a law in the state providing for Medicaid expansion.
Right.
So until that law is repealed, citizens of that state are eligible for Medicaid no matter what the federal government does.
Okay, that's all fair for 1 year, but after
for Medicaid.
In that case, but let's go back to the example of the health insurance company where you're in a policy that is compliant with the Affordable Care Act, but in a year the health insurance company can say, well, now we don't have to follow all those stringent requirements of the ACA, so now we're going to change our plan and we're not going to cover pre-existing conditions and we're not going to have a lifetime cap. And
well, not necessarily, because that's all dependent on state law now, not federal law. So again, in order to implement a lot of these laws, states enacted changes to their laws. So just because the federal government says, oh no, we're repealing everything, you have to look to the laws in your states. And most states actually had programs, before the Affordable Care Act was passed, 100% of states had programs for people with pre-existing conditions. It was enacted when we had the AIDS crisis, when there was the AIDS epidemic. Mm-hmm. So there was coverage for people who were sick. What the problem is, and the problem now is, that it was never free, but it's not free now.
Right.
So in the old days, what would happen is you'd get a letter of an insurance company would say, we're not going to cover you because you have a pre-existing condition. You have diabetes or you had cancer or whatever it is. And then you could take that letter to the state insurance board, and then the insurance board would put you in the high-risk pool. And then you would have to buy insurance. And one of the deals that was cut with the insurance companies was they had to offer the high-risk pool insurance at the same price as an average cost for a person their age that was healthy. So it wasn't free, but it was available. And it was available in every state.
Okay. Well, people like to complain about bureaucracy, but when someone's trying to do something bad, that bureaucracy can be your friend, because it takes a lot to rewind all the protections that the ACA put in place.
But my point is, not all of the protections are really, they accrue to you through your state.
I got it, yeah. But that's the bureaucracy I'm talking about. In the United States, you have federal law and state law. And Well, thank you for joining us. So the book is Urgent Care. How can people get this book if they want to read and get the full scope of what you're saying?
They can go to Amazon.
So it's available through Amazon.
And buy it at Amazon. That's the easiest way.
All right. Well, Minda, thank you for coming here and being on and talking about health insurance here on TYT Interviews.
Thank you so much for having me. I really appreciate it.
Glad to have you. Thank you.